Okay, so we'll finish up about intracranial pressure elevations and move into the complication, which is a herniation, and things that you would see associated with that. When we look at increased intracranial pressure, again, if you can just imagine for a minute something going on inside your head that's just increasing in size and putting pressure, headaches, and it can stimulate seizures, and obviously a decrease in level of consciousness, which we said was one of the earliest and most reliable signs of increased intracranial pressure. But there are some other things that you can associate with increased intracranial pressure and changes in the patient's posture, which you'll see as we come in the next couple slides. They have decerebrate or decorticate postures, or they can become flaccid. Generally speaking, with our infants, they can have those like bulging fontanelles to show that they have too much pressure. They have a very high-pitched cry. Lots of people, when they have swelling, you think about the soft tissue, so they'll have papilledema where their eyes may swell, dilation or pupil changes. These are all things that would tell you that there's something wrong inside the brain. And you also see the Glasgow Coma Scale, and we're going to go into that a little bit more in just a bit, but that is how we evaluate somebody's level of consciousness. So we're going to go into that in just a second. So let's talk about brain herniation. Basically, you have an increased intracranial pressure, which pushes the brain out of its normal position, and that tissue becomes compressed. We focus on, there's different types of herniations. The one that we see most common is called an uncal herniation. Basically, what we see, there's a compression of the oculomotor nerve is an early sign. So there's so much pressure, the herniation begins to occur, and it compresses the oculomotor nerve, which is cranial nerve number 3. And we should know that that nerve controls pupillary constriction. And so oculomotor nerve, cranial nerve number 3, controls pupil constriction to light and indicates that we have upper brain function and upper brain stem function. If that's intact, then your pupils are going to constrict when you shine light in it, and they'll dilate back whenever there's no light. So when those things are happening, that's why we assess that as a neurologic function. We know that these people have intact brain stems. When there's a compression on the oculomotor nerve, it causes what we call ipsilateral pupil dilation. So pupil dilation that occurs on one side, and it's usually the affected side. So you have something going on, you see this patient has some changes, and when you're doing your pupillary reflex, you notice that on the left side, that pupil is dilated. And when you shine a light in there, nothing happens. They lose that constriction ability because that nerve is compressed, okay? And that tells me that the pressure is on this side inside my head because it's ipsilateral. It's the side that is affected. So when we talk about manifestations, outcomes, what assessment findings are associated with brain herniation on the next slide, again, ipsilateral pupil dilation is something that should be a trigger, something for you to know something's wrong, okay, when you see that going on. Even though, like I know that this is an expected thing with herniation, but herniation is a complication. So this is a sign of a complication. The respiratory system, they have a depressed respiratory response, so their breathing kind of shuts down. They breathe a lot slower. They're not blowing out as much carbon dioxide, so they retain that. Everything slows down. They have decerebrate posturing. Generally, this is the picture on that you have on your slide with the arms extended out, with the wrists that are rotated out. And the legs, generally speaking, or the feet are plantar flexed, so they're straight down and slightly internally rotated. These are some of the positionings posturing that you may see. They're with that decerebrate, their jaws clenched shut, necks extended, arms are adducted, so away and stiff from the body. The forearms are pronated. All of these things is signs of posturing that can occur. What complications can result as a result of brain herniation? Well, obviously brain death. It herniates through a valley, then it would compress it, and you could have brain death. and respiratory failure, because you're quit breathing. The brainstem is what basically helps us remember and tells us to breathe. So respiratory failure would be a major complication.